Today we're talking about dizziness, that strange feeling that makes you feel off balance or just not quite right. You've done all the blood work and maybe even had a brain scan, but it all comes back normal and your doctor shrugs saying it's probably just anxiety. But here's the truth. Dizziness is not a mystery, it's a pattern. And when you know what to look for, that pattern starts to fall into place. By the way, I'm Dr. Mitch Rice, board certified family medicine physician with a focus on integrative care, and this is the exact four-step framework I use for my patients every time to figure out exactly where the dizziness is coming from and what to do about it. The first thing you need to know is that dizziness or feeling off is not a diagnosis. It's a symptom. It's essentially smoke. And when you follow that trail of smoke, it takes you directly to the fire, which is that underlying diagnosis. In my clinic, I found that 95% of the time, dizziness traces back to one of just 6 major categories, and we're gonna break them down right now. Imagine standing up suddenly and your brain being like a half second behind of what your body is in terms of receiving enough blood. Essentially like your blood pressure just hit the snooze button for a second. Well, this is what happens with orthostatic hypotension, and this is one of the most common causes that I see of dizziness in my clinic. If you get dizzy when you go from sitting or lying down to standing suddenly, this is your blood pressure dropping too quickly and your brain isn't getting enough oxygen. Here's how to check if you have orthostatic hypotension, and you can do this in the comfort of your own home. Measure both your blood pressure and your heart rate laying down for 2 minutes. Stand up quickly and then recheck your blood pressure and your heart rate after standing for about a minute. If the top number of your blood pressure drops by 20 or the bottom number drops by 10, or if your heart rate jumps over 30 beats per minute, this is a clue that you may have orthostatic hypotension. The important fix to do this is not only to increase your water intake, which is what a lot of doctors say, but you have to increase the solutes so the water's actually getting to the right places. The second most common thing that I see is a vestibular imbalance. Now imagine for your second that your inner ears are your gyroscope. It helps your brain know where your body is in space and time. If rolling over in bed or bending over and tilting your head in a specific position sends you spinning, your gyroscope may be out of alignment. The most common reason that this occurs is something known as BPPV, or benign paroxysmal positional vertigo. It's a little bit of a mouthful, but it is super treatable and very common. Some other ones include vestibular neuritis or labyrinthitis that often occurs after some sort of sickness, or even fluid buildup within those inner ears. These don't show up on blood work. You need a good physical exam in order to diagnose these. And in many cases, physical therapy or Epley maneuvers can solve the problem in a matter of minutes. Now, do you ever get dizzy when you're scrolling on your phone and looking down while a car's moving forward? This is known as Vestibular-Visual mismatch. That is a common occurrence of transient dizziness. What I mean by transient is it lasts for a little bit of time and then you have periods where you feel absolutely normal. This occurs because your eyes are saying one thing, but your brain is interpreting something else, and your balance system is just trying to get calibrated. It's very common after whiplash injuries, long COVID, chronic neck tightness, or just simply overusing those screens. It's essentially like trying to watch a movie where the sound is out of sync by about 2 seconds. You can kind of do it, but things definitely don't seem right. This is where vestibular rehab or a neuro-optometrist can really work wonders. Now, if your dizziness comes on after you eat, or your dizziness comes on when you haven't eaten anything for a long time, this likely has to do with blood sugar swings. Reactive hypoglycemia can cause dizziness, shaking, feeling spaced out, feeling like you're gonna pass out, and even becoming sweaty and anxious out of nowhere. I see this all the time in patients who skip breakfast frequently, rely on oat milk lattes or smoothies for nutrition, and eat high-carb meals with very little protein or fiber. Even without diabetes, insulin resistance can create episodes and waves of crashing sugars. Now, I do have to talk about dizziness and anxiousness because the two at times can go hand in hand. Just because the two are related though, doesn't mean that the dizziness is all in your head. Your nervous system is like a thermostat, and sometimes that thermostat gets stuck on high. This isn't just a psychological cause, it's a physiological cause. Common symptoms and things that I see from patients are things like jaw clenching and shallow breathing, feeling like your center of gravity is off, and overreacting to certain lights, sounds, and movements. You don't need therapy, you just need a hard reset button, which I'll talk about here in a few minutes. Now, the sixth and final category is the curveball of all of these, and something that you may not have heard of before. It's called a vestibular migraine, and fun fact, you actually don't need to have a headache at all to have a migraine. Honestly, vestibular migraine is one of the most underdiagnosed problems when it comes to dizziness. And here's how it looks different than a traditional migraine. You may not have the head pain at all, but you can feel dizzy, off balance, having a lot of brain fog, be very sensitive to light, sound, and complex movements. Think of sitting at an intersection and just watching traffic cross. Or you may even feel that the world is tilting a little bit side to side. The root cause of this issue is a brain sensory problem. It's similar to the visual vestibular mismatch, but it comes in the form of episodes and behaves like a migraine. Common triggers of vestibular migraines include sleep deprivation, hormonal shifts, certain foods like red wine, cheese, MSG, and chocolate, and even dehydration and stress. Most doctors tend to miss this one because you look fine on paper. But if your symptoms come in waves and really don't fit any other patterns, this is one that you may have had for a long time and didn't even know it. Next, we're going to talk about some blood work that may be helpful if you're struggling with dizziness, but honestly, most of what falls in those 6 categories we just talked about, blood work isn't really going to help you a whole lot. Dizziness is often pattern-based, so it's really important to track your symptoms meticulously. However, for someone that does struggle with dizziness, these are the labs that I typically order. I get a CBC or complete blood count that screens for anemia, a ferritin and iron panel that checks for iron stores, vitamin B12 and folate that's needed for nerve and brain health, a TSH-free T3 and T4 that evaluates your thyroid function, fasting insulin and glucose, which rules out those blood sugar crashes, a morning cortisol, which can check for adrenal function, and a comprehensive metabolic panel that looks at some electrolytes and fluid balances. Now, these are the exact labs that I start with, but blood work is only as good as an individual that interprets them the right way. Now, if you've ever gotten normal lab results, but you still feel off, or just want to know which numbers actually matter, I made a full essential blood work guide that breaks this all down, and you can check it out for free below. Now, so far we've covered the 6 major categories that dizziness tends to fall into. We looked at orthostatic hypotension, which is sudden drops in blood pressure when standing, inner ear issues like BPPV and vestibular neuritis, visual vestibular mismatch, think scrolling on your phone while a car's moving, blood sugar crashes, which is dizziness that occurs either in between or shortly after a meal, nervous system overdrive, which is triggered by shallow breathing and overall tension, and vestibular migraine, which is a hidden cause of dizziness that a lot of people overlook. We've also talked about some blood work, knowing that most of the time, blood work for dizziness doesn't really give you the full picture, but it is still useful to get. Now, I want to talk about what you can do right now in order to actually get your dizziness to go away, even if you're still waiting and figuring out that underlying diagnosis. So the first thing that I would do is an electrolyte reset. What I mean by this is increasing those electrolytes to not only raise your blood pressure slightly, but also to help your nervous system fire in the proper way. This can be done by adding about a 1/4 teaspoon or a little salt bay action to your morning water and adding a slice of lemon. Now, of course, if there's a reason that you have to avoid salt, like for heart conditions, don't do this. But for those of you who don't have any other issues, adding that pinch of salt and a slice of lemon in your water can really go a long way. In conjunction with this, we want to stabilize those blood sugars by eating a significant amount of protein. This is really important to do in the morning. You want to try to reduce your overall levels of carbohydrates, not really consume any sugar, and then increase or raise the levels of protein that you eat. Doing a nervous system reset can be quintessential in getting that dizziness to go away. And one of the best ways that I like to do this is by doing box breathing, which essentially means that you breathe in for 4 seconds, you hold it for 4 seconds, you breathe out for 4 seconds, and then you hold it 4 seconds. And repeating that process creates a box. And I would do this for about 2 to 3 minutes at a time, as many times as you want throughout the day. Some vestibular training exercises that you can do, or getting your balance system kind of in sync, would be doing gaze stabilization, meaning you stare at your thumb like this and move your head back and forth, just like I'm doing right now. And you can focus on balanced walking by doing heel to toe walks with your eyes closed, about 10 feet down and 10 feet back, doing this multiple times a day. And to combat those vestibular migraines, there's a few steps that you can do immediately. You really want to try to regulate your schedule by going to bed and waking up at the same time every single day. Try not to skip any meals and eat continually every 3 to 4 hours. Do your best to avoid scented candles, perfumes, and fluorescent lighting. Cut back on things like red wine, aged cheese, caffeine, and chocolate. These are highly known to trigger migraines. And you can try both some magnesium glycinate at around 400 to 500 milligrams per day, as well as vitamin B2, 400 milligrams per day, as these two things have been shown to reduce the frequency of migraines overall. Now, this doesn't have to be forever, but it's at least until you get some of the dizziness under control. Now, I want to talk about when dizziness isn't just annoying, but it can possibly be urgent. These are some red flags that would make me want to get a closer look. So if you have dizziness with slurred speech, facial droop, or sudden weakness, or if you have dizziness with hearing loss and ringing in one of your ears, dizziness with chest pain or passing out, dizziness with severe balance issues and you can't walk properly, or dizziness with progressive weight loss or numbness in other area of your bodies, these are things that would definitely make me want to get into a local healthcare provider. All right, we've covered a lot of information, so I want to do a quick summary to hit the high points. We've talked about the 6 root causes of dizziness that make up about 95% of all cases, including orthostatic hypotension, inner ear issues, visual vestibular mismatch, blood sugar crashes, nervous system overdrive, and vestibular migraines. We've also covered some lab work, although may not get you to the actual root cause, but can be helpful in diagnosis. And while we're waiting for those labs to come back, or even if they're all normal, you want to make small lifestyle tweaks like adding some salt to your water, trying to eat protein first whenever you eat food and consume more of protein, use nervous system resets, try to focus on your breath work, and even try some supplements like magnesium glycinate and vitamin B2. For vestibular migraines, you really want to keep things consistent by going to bed and waking up at the same time every day, as well as keeping your meals consistent. Finally, dizziness can be scary, but it is not random. By the way, if this video made you feel seen or supported, you're not the only one searching for answers. That's exactly why I built my free community, Vitals and Voices. It's a smart, supportive community that you can share your experiences with others who may be dealing with your same symptoms. I've linked it down below. You can check it out completely for free. When my heart is overwhelmed, lead me to the rock that is higher than I. This is from the book of Psalms, chapter 61, verse 2. Even when the ground feels unsteady, there is a foundation that is more solid than just your symptoms. Clarity is coming, and you're not gonna have to walk through this alone.